Hey guys, it's Mara. I wanted to do an infertility update. A lot has happened to me in the last 2 months. I would say everything started early May when the ball started rolling, when I figured out a lot of stuff. So I kind of wanted to give you guys an update. I did post about it on my Instagram, but it's not like many people probably follow me on there from here, and that's fine. But basically, so in March, I called to my local hospital that's with my insurance, and I scheduled a regular women check, an OB, because it was time for me to get another PAP done. And I also wanted to kind of have somebody in town, in OB, because since I moved, like 2 years ago, I haven't got an OB around here. I did see a hormone physician, but he's not an OB. So anyway, I scheduled that back. I think it was in March, for May 4th, because that was the soonest they had available. At first, I did want to go with this OB doctor lady, but she was booked up and she wasn't taking any new patients, except for women who are already pregnant. So they said, would you mind seeing a nurse midwife? And I was like, a what? And she's like, oh, it's like a nurse practitioner, that they then get their midwife degree. And I was like, oh, that's pretty cool, because originally I wanted to look at the first OB, because I'm like, I want somebody somewhat semi-holistic, not like, I'm not the biggest Western medicine person, although I work in the medical field. And I don't know, I just made this up in my mind, but if I saw on their About Me's, if they're bilingual, like if they also do Spanish, I think they're more, I don't know, I think they're more open to different ideas and things like that. So I think both of the ones that I looked at and the one I ended up going with, I think they both had that they spoke Spanish too. But anyway, that was just something I was like, that I just feel like they're more open culturally and whatever. Okay, I'm going off on a tangent. So anyway, I had my appointment on May 4th. I think at first it was going to be the week before, but I went in, and right off the bat, I think she's super nice. I was kind of explaining my story, how we've been trying to conceive for, 2+ years, and she asked me, she did my PAP and all that, and she asked me if I'd ever had a transvaginal ultrasound. And I said no, but I'd really like one just to kind of see how things are going. I told her I do have, allegedly I have PCOS. I mean, I do. But I've never had an ultrasound to verify. So she's like, oh, but I can get you scheduled one when you leave. And I was like, okay, great. So I went and scheduled it. So that was on like Monday or Tuesday, and then they actually had an opening for Thursday, because the Rona, and I don't know, they just had availability. So I went in on that Thursday, and it was pretty simple. Some people say they hate them. I didn't think it was that bad. But I went in and got it, and on the ultrasound, what I could see, I'm not, an ultrasound reader person. I don't know exactly what I'm looking at. But I did notice that I had a really big cyst. And so she said, well, I think later when I talked to my physician, that it's probably a follicular cyst, so one of the kinds that will, rupture when you have your period. But it was pretty big. I think it ended up being 2 by 3 centimeters, which is pretty large. But anyway, so I saw that, and I did see that I had cysts like lining my ovaries, so it was, I do have PCOS. But when I left, I was like, oh, I thought it went pretty well. And then the ultrasound tech was like, when is she going to call you? And I was like, oh, she's going to call me tomorrow because she's off today. She said she'd call me on Friday because this was Thursday. And she's like, okay, and I was like, I thought there was something wrong. I felt like the way she worded it, that something was, serious, but obviously they're not supposed to tell you And I knew she kept going back and forth, like on both sides of my ovaries, and like kind of like measuring stuff. And I thought she was measuring my endometrial like thickness, which I think she did do that. But that wasn't all. So, then my doctor called me on Friday and she said, oh, so my cyst was 2.5 by 3 centimeters. And then she's like, and you have a septated uterus. And I was like, a what? Oh, okay, great. And she said, and I said, is it a complete septate? I think when I had talked to her later, after the weekend, after I kind of like researched some stuff, and ended up, mine's like a, 75%er septated. It's not fully septated, but it is really large and I guess long. I don't know. But she said, do you have anybody that you want her to refer me to? And reproductive endocrinologist. And I was like, yeah, no, didn't know that was a job. Like, no, I don't know anybody. And she's like, well, I had referred my last patient to somebody in Kansas City. Do you want me to refer you to them? And I was like, okay, like I don't know any different. And she basically said, like, this is beyond our scope of practice. That's why we're referring you to somebody, because they don't do these surgeries. I have read some people's OBs do the metroplasty hysteroscopy and go up there and do the cut-ins, but, especially with mine, it's not like an in-office procedure kind of deal. So she referred me to that person, or, well, allegedly she referred me, but she hadn't at this point, and I didn't know that. So anyway, by Monday, I still hadn't heard anything from this office that she referred me to. So on Tuesday, I called them because I knew she gave me the name, and they didn't have any of my info. And so I started giving it to them, and then they like wanted all like Marin's insurance info and all this stuff. And I was like, oh, like you guys just don't do the surgery. And they're like, oh, basically we only do the surgery if it's, promoting fertility, which I understand, but I don't know. I just got some weird vibage off of it. So, I wanted to look around to kind of see other places. My mom had looked online, looked on YouTube, and had found Missouri Fertility, which is in Columbia, which is another hour-ish away. But I'm like, well, if I already have to go like 3 hours, what's 4 hours, So I gave them a call. I have my notes over here because there's so much. I gave them a call about noon and gave them my info. And then they called me back at 4:40. So I get off work at 4:30. So it was right when I was leaving work, like pulling out of the parking lot, and I just like did a loop, came back around and talked to them. And they said that they could set up a Zoom appointment as like a consult appointment and all that for May 26th. And so I was like, okay, that sounds great. I gave them my insurance information, and they were going to call me back. I don't remember what that was about, but whatever. So, let's see. That was on Wednesday. That was on Tuesday. Then Wednesday, the surgical nurse, that's what they were going to call me back. The surgical nurse was going to call me back because I wanted to see, like, what time frame are we talking about with this kind of surgery? Like, how is it so many months because of the Ronas? Like, how far out are we talking? Because I don't want to wait months maybe at one place, but maybe another place can get me in sooner. Obviously I want to go to a quality place. But anyway, so she called me back, and she said it is probably a couple months out because they did have to scale back their surgeries, I think, to only 1 day a week. Now they're up to 2 days a week. So they have a lot of backlog of surgeries that they're having to go through because they had to stop surgeries for a while. So let's see, that was on Wednesday. Then Thursday, May 14th, the OB office called me about the referral to Missouri Fertility and not the other place in Kansas City, because I had emailed my nurse midwife, and I had said, actually, I'm going to go with this place. And so she had talked to the nurse that does all the referrals, and then they had called and said, okay, we're going to refer you to this, send all your ultrasound pictures and all that, and get your information sent to them. Another thing I forgot to mention was that the nurse midwife I saw, she wanted me to get my hormone levels rechecked because I've only gotten them tested by saliva before, and she wanted to see them on like the 3rd day of my period, which I don't think that's when I'd ever had gotten them checked. And so my period had started like right around all this. And then so on May 20th, I called about 3rd day labs. And so she got me the paperwork, and I think I went and picked those up. And then on Friday, I went to LabCorp, and that's when I got my thyroid done because I was on a really high dose of thyroid medication, and she wanted me to get that checked. I also got my FSH and estradiol. And then also, I talked to Missouri Fertility on that day, and I called about my Zoom appointment, and I scheduled my diagnostic ultrasound, and that was for June 12th. So that was, you know, a little far out, but not too bad. And let's see. Oh, so then on Monday, I wanted to try to get all my lab work to their office before my Zoom consult, because I know that's, you know, some information that they wanted. But on Monday, that was Memorial Day, and so LabCorp was closed, so I couldn't call and get that information faxed over. But on Tuesday, I called, and then I called the lab office that I had went to, and they couldn't get my information sent over, and it wasn't available to me online yet, so I couldn't just tell them what it was. And so I had to end up calling customer service, and I had to like wait online, and then I finally got through to somebody, and they faxed over the information, which was funny. When I was in my Zoom consult meeting, I was like, oh, I faxed over the papers, I hope you guys got it, and then like the nurse had like just brought it in, so it worked out really well. Yeah, so I had sent that over at like 8:30. I also had to call my OB office, and they had to review the results and then send it, or I had called them to see if they could fax it or something. I think that's what happened. I didn't actually have LabCorp send it, but they reviewed it and then sent it on and faxed it for me. So that was at 8:30, and my appointment was at 9, so I was like trying to get stuff done. This day I did go into work late so I could, you know, get all this work done. But the office called me beforehand. I paid my copay, which I think I should get that back, because technically with the Zoom consult meeting, even though it's a specialty office, I think they're free, and I've been getting all my like my explanation of benefits and stuff like that, so I think that office visit was actually free, Zoom office visit. But anyway, and then I also went ahead and paid for my diagnostic ultrasound, even though it was like in 2 weeks. But he told me that that my, you know, my septate from the ultrasound pictures, he said he only gets like the black and white version. I thought maybe they send him a CD, I don't know. But it looks like I'm about 80% septated, and he said there's about half and a half chance, 50-50 chance that I have endometriosis as well. I do have a lot of bowel issues, of course. I have like gluten, soy allergies. We don't know what all my allergies are now. For sure soy, maybe not even gluten anymore, but you know, why risk it at this point? With this septated uterus, I do have what's called a Mullerian abnormality, which that's different issues with your uterus. You can have like a double uterus, you can have the septated uterus, you can have a bicornuate uterus, which is a heart shape at the top. You can have just like, you know, tubal stuff. Anyway, there's a lot of different variations, and I think I'll go ahead and put in a chart here. And that kind of explains the different kinds that you can have. So I have a septated uterus, and he told me that he didn't think I had a bicornuate uterus from that picture, but I'll talk about that later. So I told him, because he was like, oh, do you have I guess he asks everyone, you know, do you have like bowel issues, because that usually indicates like the endometriosis can actually adhere to your bowels. And I was like, yeah, like, or something. I don't forgot what the question he asked, like do you have poop issues with your period. And I was like, doesn't everybody? Apparently not. But I said, I have different like food sensitivities and intestinal issues. And he goes, well, basically, I want you to eat kind of like the caveman diet. Can you eat meat? I'm like, yeah. Can you eat salad? Yeah. He's like, can you eat vegetables? I'm like, yeah. And he's like, basically eat that to help lower my insulin, to help with my PCOS. Now I do, for the most part, eat a diet pretty close to that anyway. I do have minimal grains. I do eat like rice and quinoa and sweet potatoes, red potatoes, not like the big baked potatoes too much. But yeah, so I have moderate carbs. Sometimes I have, big rice dishes. But anyway, and he wanted to change my thyroid medication. He said that was like way too much, which I kind of knew. And so he wanted to put me on levothyroxine, which I'd always been on more natural, Nature Thyroid, Armor, compounded thyroid, but I'd never been on levothyroxine. So he's like, well, we can try this at 70 milligrams. So I've been on that, and I've actually been doing fine. I haven't really noticed much different from taking other thyroid medication. Some people do have an issue of what is it? It's either T3 to T4 or T4 to T3 conversion, and so they're low still on one of them, whichever one it is. I can't remember right now. And so some people, levothyroxine doesn't work very well for. They're still tired and all that, but I think I convert fine, so I'm all right with that. Let's see. So then I got a call at some point. What day is this? Who knows? Oh, I think this is all during my Zoom call. He said my surgery probably wouldn't be till the end of the summer or early fall. And he called, I told them to call in my thyroid medication to CVS, which is always like a dumpster fire. And so like they had to call CVS and leave a message to put my prescription in. Then I called CVS and they said they didn't have it, and they had listened to all their messages. And anyway, they did have it, and they filled it later. But I was about to call it to my local pharmacy, which I ended up calling them back and saying, hey, they don't have it. Can you just call it this other pharmacy? CVS is always like crap. They're on my crap list. So anyway, then ended up they both had it. So when I tried to fill it the other place, they said, oh, it's already been filled. It says it's too soon. It's been filled today. And I was like, freaking CVS. Anyway, so that was a mess. But so I ended up getting it at CVS. But this last month, I got it from my local pharmacy because it's the same price. I'm like, they're so much chiller. They have like a drive-through. It's not like a big mess. CVS like harasses me and calls me like every day, want me to come refill or pick up my medications. Anyway, they're annoying. So I'm going with my local pharmacy now. But so whatever day that was Tuesday, right? So then Thursday, okay, so that was on Tuesday. Then on Thursday, the nurse called me, and she said they're only doing surgeries now on Monday and Wednesday, but that she had a date available in like the third week of July. And so I called Marin. I asked him, hey, would that work? He said yes. So I called her right back, and because she had said, if not then not till August. So I finalized that date. And she said like 4 days before, I'm going to have a pre-op phone call with the doctor. And I forgot I hadn't mentioned him yet. It's Dr. Wilshire. It's Gil Wilshire. Like sometimes I mess up and say Gilshire. That's not his name. It's Dr. Wilshire. Anyway. And so I'll have a phone pre-op with him. And after the pre-op, I have to get Rona tested. So at first they said that Friday before, but then I had called her back and talked to her, and I said, is there any way I can get it done on Thursday? Because I'm really afraid if I do it on Friday, we won't have the results. They won't be back yet. And I'm like, worried about that. And so then later she said, yeah, I can go on Thursday instead. So she wanted me to call and tell her what fax number. So the local OB office that I go to, they actually can do the testing there. They have a little lab downstairs. And so I got the fax number for all that. And then she said, with the surgery, everything will get pre-certified with my insurance for costs. I can't eat or drink anything after midnight. I have to do light meals over the weekend. And then I have to do magnesium citrate, which basically is like you know, if you've ever had a colonoscopy, it's just like a kind of like a light bowel prep, not the full bowel prep, but so it's just a magnesium citrate drink. It kind of cleans you out, and then you eat light the next like a day, and then not eat anything after midnight for Monday. Let's see. So I decided to take off that whole week because recovery, they act like, is just a couple of days. At this point, we did discuss doing, he does what he calls a bumper-to-bumper warranty, I guess. But it is a hysteroscopy and a laparoscopy, which means they go up, and then they also go in through your belly button and I think like near your pelvis to check for endometriosis. Now, so that's going to be a little more recovery time than if you're just getting the hysteroscopy where they're cutting the septum. But let's see. Next would be May. Oh, I'm still on Thursday. Thursday had a lot of stuff going on, the May 28th. And I messaged my OB and asked her if I could get the testing done there. And she said, yeah, that we get an order from her if their order doesn't come through. And one of my coworkers called and to get their fax number so I could send it over to them. And I even called the company that does their coding and to find out what their turnaround time is. I got a lot of people that like work there too, not that do their own testing, but people that work at the hospital, and they knew who did their testing, so I like called them up. I was like, hey, how many days is your test take? So anyway, now today is June 29th. So a few more things have happened since then. I didn't write them all down except just like a couple of minutes ago because I'm trying to like remember everything. But on June 4th, so that was on a Thursday, Marin and I drove up to Columbia. Wait, no, not June 4th. Is that right? Was it the 11th? One moment, please. Okay, I don't know, whatever day it was. It was either the first or second week of June. But on the Thursday, Marin and I drove up after work, and my brother works for Drury, so he gets a special deal. So we could stay at the hotel up there. It's only it's probably like in between 5 and 10 minutes away from the clinic. So we drove up that night. We got there, I don't know, by like 8 or 9, I think. And then the next day was when we went to the clinic. We picked up Marin's specimen container because he got a semen analysis done as well, since we are, you know, trying to get pregnant, as well as trying to fix all the doodads. So we went and picked that up. He did his thing. We took that back at 10:30, and my appointment I think was at 11:30. I'm trying to remember. But I went in, I got checked. They do your temp, all that, and she took my blood pressure and my weight, and then I went back into the room, and it was the same nurse. She also did my ultrasound, so I'm like, man, they're multi-talented here. So she did the ultrasound, and then the doctor, or she set me up for it, and then the doctor came in, so I got to meet him besides just the Zoom consult, and he explained what they were going to do, and I'm like, yeah, I already had one done, like, I know this, you know, transvaginal ultrasound. And so he went in, so he checked everything. At this point, he said I'd actually ovulated the month before, which I was like, I thought I had, which was really rare because I don't normally ovulate. Women with PCOS have that issue. But I noticed my cervical mucus was different last month, so I thought I had, but I was like, maybe I'm wrong. But he said it looked like I had. My cyst was gone, so it had ruptured. When I had my period, which was interesting because I was talking to one of the ultrasound techs that I work with, and or x-ray tech, sorry, but she used to be an ultrasound tech. Anyway, she's like, oh, that one's gonna hurt like really bad. Well, the morning that like my period started, I like woke up and I was like, oh, you know, but like it didn't hurt that bad, not any more than some of the cramps I have. So I was like, maybe I got this large a cyst all the time, who knows. My 2.5 by 3 centimeter one. So he said that, and it looked like I was getting ready to ovulate again. I was like, wow, okay, I don't know that I did, but last month I definitely did. So that was cool. That was nice information to know. Obviously, to have baby you need to ovulate, but well, one of the ways. What else? He also had the results already back from Marin's analysis, and he said everything looked really good. Like, he was super shocked, I think. I know from watching some of his videos, which I will link down below, that men in Missouri have a lot of infertility issues, and I don't know why, if it's pesticides or what, but Marin said, you know, he's not from Missouri, he's from Colorado, so it was the mountain spring water apparently did his swimmers good. I don't know. But everything looked really good. The only thing I didn't have back was the morphology. I think they do a stain, and then that came back later, and that was good as well. So those results I didn't get back until the next week, the full numbers and what the morphology was. But anyway, so they did my ultrasound. The only thing that was kind of different, he basically said, which I think he said in my Zoom meeting too, I have a large ass septum, or maybe it was big ass, but anyway, I'd rather call it large Marge. I'm not insulted easily, but if I were, I was like, okay, like large ass, but whatever. It is, it's big, it's wide, and it's, you know, like 80% all the way down. So, but he did say I have a possible bicornuate or bicornate, I don't know how to say that word, uterus, which means that's the heart-shaped kind. So the top of the uterus is pretty hard to tell from ultrasound. Also, I know some people, there's a septated uterus group on Facebook, and a lot of people get the histosalpingogram, HSGs, or they'll get MRIs to see the top of the uterus. But part of the laparoscopic is to go in to check for endometriosis and also see the shape of the uterus, if it's bicornuate or not. So I'm hoping with my septum, when they remove it, or they go in there with the little scissors, I'll put that video in. He does have one of him actually doing the surgery on somebody with a smaller septum than I have, but they go until they hit like vascular tissue, so like blood vessels. But if mine is more bicornuate, they probably can't go as far until they hit vascular tissue, because you're going to, like, that dip is going to be that wall of the outside of the uterus kind of caved in into the heart shape instead of like flat. So it's a lot of it's kind of like exploratory surgery, but it's not, because they're doing things. But yeah, a lot of the things you won't really know, at least with me, I won't know until we go in and see what's going on. So after the ultrasound, the nurse took my blood. They wanted to recheck my thyroid now that I'd been on this levothyroxine 75 milligrams for a couple of weeks. And they also want to check my rubella to see if I'm immune. You want to know your immunity before you get pregnant. And what else did they do? Let's see, rubella. They did testosterone. They checked prolactin. And I think that's all. So, I think I forgot to mention this earlier, but after I got my blood taken, I had already had scheduled with the nurse, this surgical nurse. She had called me, I think it was the week before, and she had said, from your Zoom meeting, Dr. Wilshire had mentioned getting an IVP done, which is like intravenous pylo something. Basically, it's to check out your kidneys, your ureter, and your bladder. Because I have a Müllerian abnormality, there's like a 15% chance that I also have morphological issues with like my kidneys or my bladder, or my ureters mostly. I have read that like if you're a unicornate, like you just have one little horn, a couple of the other uterine abnormalities have kidney abnormalities more commonly. The septate one is one of the lesser common like associations, but he wanted me to go get that done. And so when I talked to my nurse, I said, well, I'm having my they call it a diagnostic ultrasound. I'm having my diagnostic ultrasound on Friday. Can I schedule it for then as well? And so she's like, yeah, we'll make it, I think it was at 12:45. So I got done with my appointment really pretty fast. I was in and out. and I just walked over to the main part of the hospital and went to check in. Now, they wanted me to get there by like 12:30. I was there, I think, by 12:15. I still had to wait a long time to get everything registered. They had all my information from before when I was married. I'd never been to this hospital before, but they are associated with Barnes Jewish Hospital, which I had went to a Barnes Jewish clinic before. In St. Louis, and so they had, there was a lot of information I had to change, so that did take a little bit, but I also had to wait a while. And then when I went to x-ray, I had to wait like a super long time. Now, it wasn't that bad. Some people, I think, waited longer than I did, but it depends what they were there for. But yeah, so I checked in, I went down there, and I had to wait, and like people were, I don't know, they were trying to social distance, but the lobby's really not big enough to social distance with as many people that was in there. So then she called me back. I had to put all my stuff into a locker, put on like a little robe dealie, and then just sit in the hallway with like, I think you kept your underwear and your socks and shoes on, in your little Nike robe, you know. So that was interesting. But the radiology people were super nice. I had a younger lady and then a pretty younger girl. She was really cute. But what they did was they took me back. I had another nurse. They were going to start my IV, and they apparently start your IV in a chair. And I was like, I'm going to have to lay down, or, you know, I'm going to be out. So she was like, okay. And I think at first she thought I meant, like, I'm whatever by the side of blood, which is definitely not the case. It's not the side of blood. It's just the act of getting my blood drawn or starting an IV or whatever, which I haven't had an IV on me in a long time. So they started that. I laid down on the table. It's just like a metal table. They started my IV, and which that went really good. I told her, I was like, yeah, you're going to want to go with this arm. This one's not good for anything. But I'd already had like a little bruise from when they had drawn blood over at the office. And so they take a couple of pictures, and they started the contrast. They had the like, she was like a radiology student, start the pushing the contrast, and she was like, how fast do I push it? And she's like, oh, it's like putting syrup through people's veins, so it will only go so far. Like, you got to push as hard as you can. So then they said I may feel warm, which was funny because I felt cold when they pushed it all through. And I can't remember if it was like 2 syringes, and they were like, I mean, big syringes full of this contrast stuff. So they had to push 2 of those through. Then they took more pictures, and I was like, man, I'm really getting my radiology money worth, because they took a ton of pictures. And then they have you go pee once everything's kind of moved on through and almost all the way out. And then they take more pictures once it's like fully through. So then I had to wait a little bit, and the girl got me like a little warm towel, because I was like warm little blanket towel. Because I started like shaking because I was like so cold. You know, you're like half naked on a table, metal table, and, you know, anyway, getting this contrast through you doesn't make you very warm. And so she brought me another little blanket thing, and then they had to have the radiologist come check, make sure the pictures looked like they were adequate. And then they told me that once I left, that I should call my doctor's office on Monday if I haven't heard anything yet. So this was only Friday, and I thought, well, that's kind of quick. So I didn't call them on Monday. And then it was funny, I think it was Wednesday, I was going to get ready to call them, and then they called me, like, you know, I was being psychic or whatever. So they called me and told me that everything looked good, that I don't have any abnormalities on my kidneys, my ureters, my bladder, which is good to know. And that my thyroid came back good, and my rubella came back that I'm immune, and my prolactin and testosterone were, you know, within range. They didn't give me the numbers. They still didn't have Marin's morphology results yet, but then they ended up calling me 2 days later with that, saying that everything looks good. They gave me all the numbers for everything. His morphology was good and all that. Oh, and then I'd also asked, like, how many days should I stay in town? Because I told them, you know, I'm coming in from out of town. I want to make sure that we're, you know, at least book the hotel for as many days as you think. And also, will I need a uterine balloon? So some of the women in, I've watched different videos on YouTube where they get, after they get the hysteroscopy, metroplasty, septum resection is another name. They go in and cut, you know, kind of snip at it, cut it, whatever. They get a uterine balloon to hold their shape of their uterus, or if they're prone to make scar tissue, because there's also something called Asherman syndrome where your uterus tries to like kind of like scar tissue itself to itself, which is obviously not good. But anyway, so I asked her, would I be needing a uterine balloon, and they said no, they don't plan on doing that. Other women say they also take hormones. I'm not sure the hormone protocol, if I will need to take hormones or not. Sometimes they do this to like ease the lining growth by taking like estrogen and maybe progesterone too. And then I asked her, you know, like how many days. And so she's thinking, since my surgery is on Monday, she's thinking, you know, by Wednesday, and that was my plan originally, to stay Monday night, Tuesday night, and then leave Wednesday. I could also stay Wednesday if I needed that. I think my parents are going to come and hang out with us too, because I know recovery can be pretty bad. I don't think I have an issue with anesthesia. I've been put under, I think twice, once when I was little, and then I've already had a colonoscopy before, so I know some people like come out of it like throwing up and all sorts of stuff, and I haven't had that experience. I hope that's not this time, but you never know. I've never been under this long, probably. She said it could be, they say plus or minus like 2 hours. It really depends on what they find. They find a ton of endometriosis that could take hours. I'm not expecting that, but I do think I could have some. What else did I want to say? So yeah, my surgery's coming up. I'm excited. Women get this done. It does help reproductive outcomes. Will it help me get pregnant? Maybe not. But since I have recently ovulated, I do think that was when I was doing some like cardio workouts, and from his videos, like I said, I'll try to remember to link them all below. He does say when women have like lean or athletic PCOS, which I think is the kind I have, their LH stays high consistently, which mine does. But what helps is if they run, so like doing cardio, which is what I was doing. And I started taking zinc, which I also heard can help with ovulation and like ovary health. So I started doing those two things, and I ovulated last month. So my plan is, once I get this all fixed, to do that again and see if it works. But yeah, so if you guys have any questions, I will try to answer them from my experience. I probably left out a bunch of things. I can't remember everything. But yeah, this is just kind of the not very quick breakdown of what's happened over the last like 2 months, and where I'm at right now. Oh, but I was saying, you know, it helps you not miscarry, because with this large septum, a lot of times you can still have a pregnancy. A lot of times though, they're preterm, but because of mine being so big, there's not hardly enough room for the baby to grow. But I've never had a miscarriage before. To my knowledge, I've not gotten pregnant. But also that's not ovulating a lot, and this septum deal together is not a great combo. So I'm hoping to get this fixed. But if you guys have any questions, comment down below. I'll try to answer them. And thank you guys for watching. I'll catch you in the next one. Bye.